U.S. coronavirus hospitalizations reaching their highest level since winter as cases reach a 7-day average 141,000. 252,000 just yesterday. All of this is fueled by the highly contagious Delta variant. Dr. Christopher Doering, Vice President of Medical Affairs for Franciscan Health, joining me now to discuss the latest on the pandemic. First off, Doctor, good morning to you.
Hey, good morning, Scott.
All right, let's start with the Delta variant. We know it's more contagious. Do we know yet if it's more deadly and debilitating?
Yeah, that's a great question. Because the case numbers are going up so much, we are seeing increases in the deadliness, the number of patients who are succumbing to it. Interestingly, though, the vaccine does provide good protection for those who've been vaccinated. So we're not seeing as many of our older, more vulnerable people coming in and succumbing. It's mostly unvaccinated younger people than what we saw in prior surges.
All right, so many Hoosiers have had COVID, more than 800,000 cases to date. Most came before the Delta variant. Now, if somebody got COVID before the Delta variant, in some cases a year or more, does that provide them with immunity from Delta, or should they still get vaccinated, or do we even know?
Yeah, it does provide some level of protection, but again, to your point, some of those infections were a year or more ago. Immunity does wane over time. And certainly the vaccine does seem to provide better protection against the Delta variant than a wild type infection did. So it's really important, even if someone's had COVID in their past, even if it's as recent as a month or so, go ahead and get vaccinated as well to provide that extra level of protection.
And Doctor, we've learned the Biden administration could soon recommend Americans get a booster shot, maybe even this week. They're going to say that possibly 8 months after they receive their second vaccine. What are your thoughts on that, the booster?
Yeah, I think we've all expected that we were going to need to boost these vaccines. That's not unusual for this type of respiratory virus. Certainly we see boosting with other vaccines as well. And certainly as the virus changes over time with the variants emerging, not unusual that we would need to have a booster. And certainly the availability of the vaccine at this point would allow us to go ahead and move forward on that front.
Yeah, and speaking of the vaccine, the rates of getting it still lagging, rising, I believe, only modestly to about 700,000 doses a day. At one time it was about 3 million rather. What's the likelihood of reaching herd immunity as a good percentage of the U.S. population does not want to get vaccinated?
Yeah, I think when you add the number or the proportion that have been vaccinated plus those who have natural immunity, we are inching into that sort of 70% protection range. Unfortunately, because of the varying timing, the relative immunity that wanes over time, it's hard to really conceive that we will achieve true herd immunity. As variants emerge, we'll see some variability there as well. So I think our best hope is to achieve some level of sort of community type immunity to make the ground as least fertile as possible. And that way we can get to the point where they're just sporadic cases instead of these wholesale widespread surges going on.
Final question, just a few seconds left. It is a choice. What would you say, if at all, to somebody who does not want to get vaccinated?
Yeah, I mean, I think a lot of people have sort of sat out till now waiting to see, are the vaccines safe? Are they going to be effective? There's absolutely no question remaining on both those points. These are incredibly safe vaccines. They also prevent severe illness, hospitalization, and death at a very high rate. They're incredibly successful on that front. So I think if anybody who's sort of been reluctant or held out by now, it's time. Let's get vaccinated. Let's push those rates up, and let's get rid of this thing for the most part once and for all.
Dr. Christopher Doering, we appreciate your time this morning. Thank you very much.
All right. Thanks. Good to be with you, Scott.
No problem. Hey, Daniel, over to you.